Representative Davis, members of the committee, thank you for giving me the opportunity to testify in support of House Bill 1114. My name is Nadia Ismail. I am a pediatrician and a member of the Executive Committee of the Illinois Children's Mental Health Partnership. I would like to begin by thanking a member of this committee, Minority Leader Belloc. She signed on to sponsor this bill. She was the first person within the House to sign on as a sponsor. She has also demonstrated her commitment to youth mental health programs for years. She was a key sponsor of the 2003 Illinois Children's Mental Health Act, which made the formation of our organization possible, and we are grateful to her for her continued support. Members of the committee, House Bill 1114, also known as the Double Check Bill, is looking to improve the mental health outcomes of the next generation. As a physician and a member of the Illinois Children's Mental Health Partnership, I know that mental health is an extremely important and underestimated part of health, which affects so much of a young person's life, including their physical health, which affects their outpatient hospital visits, also known as sick days, and partly, consequently, their ability to perform well in school. House Bill 1114 was introduced in response to the devastating statistics regarding Illinois children's mental health outcomes. These have persisted despite our state's major strides in developing a stronger mental health and behavioral infrastructure. Suicide is the third leading cause of death among Illinois adolescents, and a quarter of our state's children are clinically depressed. Everyone expects someone to intervene, but in reality, 80% of child mental health disorders go undetected, untreated, and worsen as the children grow into adulthood. The only person who is legally mandated to check the normality of a child's mental health is their physician. We're required to check off whether the child's mental health seems abnormal as part of the school mental health, as part of the school physical health examination, school health examination. However, we pediatricians rarely have more than 11 minutes to spend on each patient. Despite learning about mental health conditions through our psychology rotations in our medical education, we actually do not have enough time to perform comprehensive mental health examinations. House Bill 1114 seeks to remedy this issue by utilizing the newly strengthened Illinois social service provider infrastructure, and particularly in light of the 2014 federal grant to the Illinois State Board of Education through the Now is the Time program, to assure that each K-12 student in Illinois receives an additional and more comprehensive mental health screening through their schools. As Professor James will explain, House Bill 1114 amends the Illinois Department of Public Health Certificate of Child Health Examination form to assure that school-based mental health screenings are taking place, just as the same form assures that hearing and vision screenings occur in each of Illinois schools. As I've said before and cannot overstate, mental health for our children is as important as their physical health, and it's time for us to show that we care by changing the school physical into a mental health exam as well. Thank you for your time. And